This TRACE training session will cover how to use your HL7 interface with TRACE. TRACE now communicates with your hospital patient management system, systems such as Epic, Midas, Meditech, and many others. Let's look at this now on how to use. First, I'm going to go to the upper right-hand corner of the screen, and I'm going to collapse this inbound faxes so I can see the full fax. Simply enter in the patient name that you wish to search for, or if you choose to search by account number, medical record number, or date of birth, you can do that now. I'm going to select search, and then my search results will display. You'll notice up at the top, these are manually entered demographics. We know that because there's missing data in the field, as well as there's no green check mark. A green check mark by a record indicates that it was retrieved from your patient system. I'm going to scroll down and find the HL7 interface. And you'll see here on this particular record, date of birth May 13th, 1981. We have an account number, an admit date, and a medical record number, as well as a site number. A site number applies to your specific facility if you're in a hospital-wide system that has many sites and locations. If this is a particular patient and the admit date coincides with the order or the fax, you can simply select the patient and it will automatically populate. If you have actions you need to perform, you can do that as usual. When you're finished, go to your Patients tab and save and mark as complete as usual. And the next fax is going to display. And I'm going to leave it on a collapse mode right now. I want to enter in the same patient and search. And we see here we're at our HL7 interface, and perhaps this particular fax is an order or a transaction that is to be done in the future and the patient has not been registered or pre-registered. If so, you want to select the proper patient with the right name and the right account number. However, you want to select the account number as unassigned. So again, the medical record number, the date of birth, and the name is correct. Simply select the record with account number unassigned because the patient has not been registered. Again, complete your actions as normal, and when you finish, save and mark as complete. So the system will always display all the records that have been manually indexed as well as HL7 interface. Next, I'm going to select Beach. I'm going to enter Heather. I'm going to search for Heather Beach. And you'll see here up at the top, here's Heather. The most recent is usually at the top. We've got the date of birth and account number, admit date, and the medical record number. And again, the green check mark indicates it's HL7. Anything else that's below is manually entered. And you can see here there creates a lot of duplication with manually entered data. So we always want to choose a record, if possible, of HL7. If the patient has been seen at your hospital, treated or admitted at some time, it will be in the database. If the patient's a new patient who's never been seen at your facility or another facility, obviously you can manually enter that data. So again, at any time, try to search and retrieve and select the patient that has the HL7 interface. I'm going to expand now so you can see the rest of the inbound faxes. And just to recap, the HL7 interface comes from any patient that's been admitted, discharged, or transferred from your facility. The green check mark will indicate an HL7 interface. If the patient has an unassigned account number and the order or the fax is related to a future admission, select unassigned. If you have any questions or concerns, please contact TRACE Customer Support at 877-864-2714. 2378. You may also email them at support@twsg.com. Thank you for participating in the training session.